أهلا بيكم في ذا لاونج. القلب يعني الحياة، من اللحظة الأولى لحياة الإنسان لنهاية حياته، والقلب بيعمل بكفاءة طول الوقت من غير توقف. رحلة عمل طويلة أنت مسؤول فيها عن صحة قلبك. How can we look after our heart and maintain a healthy heart? How can we prevent heart diseases? This is going to be our topic tonight, and we encourage you all to join us and send us your questions on Slido. Firstly, we're going to start and we welcome our guest speakers tonight. Welcome Abuna Elijah Iskander. أهلا بك Abuna, how are you? And welcome our cardiologist, Dr. Tamer Badia, and Dr. John Iskander. How are you? Good, good. Abuna, in the beginning, I want to talk about heart, and most of the time when we express love, we point to the heart. Sometimes we know that we say that I love with all my heart, I loved from the bottom of my heart. Is the heart the center of emotion? يعني القلب هو مركز المشاعر ولا لا؟ الكلام ده غلط.
So definitely we have feelings in our heart. We can feel them physically when there is strong emotion. And I think back in the very, very early days of medicine, when somebody would feel excited, would feel happy, then they would feel something in their heart. There's adrenaline coursing through their veins, making their heart beat faster, beat more forcefully. And so they maybe thought that the heart was the origin of all of these feelings. But I guess now we understand that these complex emotions come from the brain, and then they are felt in the heart. So the heart is a muscle responsible, and we let the doctors tell us more for contracting and distributing blood and oxygen throughout my body. But still, it can be influenced by strong emotion. When we say from the depth of my heart or with all of my heart, I guess it's just an expression which means completely and entirely and with all my being, with everything that I am, I love. So it's a lovely expression, but perhaps scientifically not the most accurate.
Yeah, I know, because maybe sometimes when anyone fall in love, for example, he feel that his heart is pumping more or something like that. So is that right? Or so that's why they link it between heart and emotions?
Absolutely. So whenever you have strong emotion, you can sometimes feel it in your heart. And there are some diseases actually which can happen. We were talking earlier about one disease called broken heart syndrome, which is when somebody is exposed to some intense emotion, grief, very bad news, that this can sometimes have an effect on the heart, and they have symptoms similar to a heart attack. They make a recovery usually after some time, a month or so, but there is a very complex relationship between emotions and the heart. But I would say that the heart, perceives or responds to the intense emotions we have, but it's not the origin of them.
Yeah, of course. دكتور تامر، أنا لو اتكلمت عن القلب كعضو في جسم الإنسان وعايز أعرف دوره إيه، what's a function of the heart، يعني مسؤول عن إيه بالظبط؟ لو حبيت أوصفه وصف بسيط كده للناس تقدر.
We're going to simplify things. فا actually got a heart here model اللي احنا هنستخدمه ونوصف الحاجات فيه. فهنوصف نقول الهارت just a pump، والبامب ده بتضخ الدم لبقية الجسم. فلو فتحنا القلب هنلاقي 4 chambers، في 2 تحت وفي 2 فوق، وفي valves in the middle بيخلي الدم يتجه اتجاه واحد. البامب ده عشان تشتغل محتاجة حاجتين، محتاجة electricity ومحتاجة petrol. فالelectricity بتيجي من البطارية هنا موجودة في القلب. This is the innate بطارية اللي اتولدنا بيها، وده بيخلي القلب أو البامب دي regular so top bottom top bottom. والبامب دي محتاجة petrol، فبيجي 3 عن طريق 3 شرايين. فكلنا عندنا 3 شرايين أساسيين في الأمام، واحد على اليمين وواحد على الشمال. just a pump that pumps the blood لبقية الجسم، والبامب دي محتاجة كهرباء ومحتاجة بترول اللي هو بيجي عن طريق 3 شرايين قدام ويمين وعلى الشمال. دي basically هي وظيفتها. وممكن بعد كده في مشاكل ممكن تحصل اما في العضلة نفسها في البامب أو في الصمامات اللي جوه القلب أو في البطارية أو في الشرايين نفسها.
يعني بيضخ الدم لكل أجهزة الجسم من خلال القلب. دكتور جون, what's our most example of known heart conditions?
So the most common heart condition is a heart attack or coronary heart disease. So as Dr. Tamer was describing, there are lots of structures in the heart that can be affected. The valves can become leaky, the pump can become weak, the electrical supply of the heart can become faulty and you get rhythm disturbances. But by far and away the most common cause of cardiovascular disease, in other words, of heart disease worldwide, is the coronary, or the ones that involve the coronary arteries, the blockages in the arteries that can lead to heart attack and death. That's by far and away the most common cause worldwide.
أبونا يعني أنا حابة قوي النهاردة إن إحنا نحاول نخلي الحلقة ما بين medical information and spiritual برضو side please. فدايما إحنا لما look after our hearts ونقول الإنسان الروحي اللي بيحاول يقوم بعبادات كل يوم ويصلي، دايما في العادي كده بنصحى الصبح ونعمل مطانيات وإحنا بنصلي. فالإنسان اللي هو طبيعي أو الإنسان اللي هو عنده أي heart condition، يا ترى المطانية بالنسبة له هتأثر عليه good ولا bad؟ يا ترى دي حاجة نشجعه عليها ولا حاجة نقول له لا؟ يعني how can we the matanyas?
Definitely, if your health allows you, it's good to do matanyas. And there are some practical benefits and then some spiritual benefits which maybe we don't understand very well. So the physical act of a matanya, of course, is takes a lot of exertion. And if somebody's doing that repeatedly, it's undoubtedly good for their heart to move the body in this way. But of course we don't do matanyas purely because it's exercise, and we can do many other forms of exercise. But there's definitely spiritual benefit when we have God's blessing, when we have our hearts are full of peace, submitting to God, then that definitely can have some benefit for us. And I'll leave Dr. Tamer and Dr. John to comment about the role or the impact of stress, severe stress in my life can have on my risk of heart disease. But undoubtedly, doing matanyas is a good exercise. So it's good for my body, it's good for my heart, but most importantly, and it's important for my spiritual life.
For spiritual life as well. Dr. Tamer, if we try to know about the likelihood heart condition in men and women، يعني الهارت أمراض القلب عموما، يعني ترى بتصيب الرجالة أكتر ولا الستات أكتر يعني؟
The risk in general of having heart attacks بيبقى أكتر في الرجالة. It's twice as common to have heart attack in males أكتر من females. But interestingly, في rare conditions which are more predominant in ladies in general. وفي حاجات معينة مثلا اللي هو بيسموهم SCADs, which is tearing of the arteries, أو اللي هو broken heart syndrome اللي كنا قال عليه, which is severe emotional stress. That part is more common in ladies, but in general, the coronary artery diseases, our heart conditions are twice more in men than in the ladies.
Yeah, it nothing has to do with the responsibility in our life. يعني if I say that more the woman can have labor. Yeah, that's I thought يعني أنا تخيلت إنه ممكن الwoman تكون.
It's just because of the hormones protect them for a long period of time until the age of 50s or 55, so they have this hormonal protective effect.
Okay. Excuse me, my medical knowledge is very limited, so that's why I'm just anyway. Thank God
that's actually an interesting point about the females. So they have lower risk. That's true throughout, much lower risk actually than men. But after menopause, after their age of 50 or 60 or so, when they stop menstruating, their risk goes up almost twice or threefold. Don't understand fully why. Maybe it's hormone related, but interesting, the hormone replacement therapy, which was thought to be protective, maybe if we replace the hormones after they lose them at menopause, that they might actually reduce the heart risk. Actually, it doesn't. It in fact increases. So we don't fully understand why that's the case. But generally speaking, women do enjoy a lower risk during the majority of their life.
Okay, I just have to flip back to our question in Slido, and there is first question is actually not related to the health, but someone said I'm a female med student and I really would like to know honestly how is it to be a cardiologist. This is a question for you, of course. Would it be hard if I start a family? So she needs your advice after a long way of career.
So in general, career-wise, career advice, this is what you're going to be doing for the rest of your life. So if you enjoy doing a job for the rest of your life, I think you should pursue that career. It does require a longer training, but and then after becoming a cardiologist, there are subspecialties. So there's an interventional cardiology which puts stents in the heart, and that requires a certain lifestyle, waking up in the middle of the night at 2 o'clock or 3 o'clock, or even doing weekends on call. John is in the middle of doing that, so it does take away a little of your social life, and it has a toll on your life in general. But not everyone does interventional cardiology. So, you know, when you finish your cardiology training, you can become a general cardiologist, and that's have a very balanced and very nice lifestyle. You can almost have an 8 to 5 job and no weekends if you like. And there's imaging and there's other subspecialties. So, I think it's very feasible, and I think we encourage people to do what they like. And so it's not. It's still family friendly, and there's a lot of push to make, and gender equality in every specialties. I'll leave John to tell us what his training is like.
Do you have any comment about that?
I mean, I work with 2 or 3 female cardiologists, and they find a really good balance between family life and work life. It obviously takes a certain amount of, planning, and that comes with everything in life, really. But I think in Australia, probably more fortunate than other countries, perhaps, who are where it's actually you can do whatever you want to do. If she would like to do
it's a good
cardiology
point
or
for
any
her
other
to
specialty.
think about her family life, or her it comes first, or maybe her spiritual life comes first before the career. So put everything according to
It can
the
be done.
family circumstances.
It can be done, yeah.
Yeah, very good. Got another question here. Hi, I have a 40% blockage in ULD. I was told I don't need stent. I'm on prescribed medication. Is it reversible? And when should I have another angiogram? This is for. Do you want to talk?
Open up a big kettle of fish there.
So in general, so it depends on why she did the procedure. So as we say, so basically what she's trying to say is that this is the heart. We have got 3 arteries supplying this heart, one front, one on the right, and one on the left. The LED is the artery at the front of the heart, and she's saying that she's got 40% blockage in that artery at the front of the heart, which is the major one. Normally 40% is medical treatment, so we don't put stents, we don't do bypasses for 40%. We only do things if they're around 70% or more. That's when we start putting stents or put bypasses, or there is symptoms. So normally it depends on her risk factors. So now that we know there is a 40% blockage, we need to control other things. So if she's got a high blood pressure or diabetes or kidney disease, or if she smokes, or high, BMI, or all these other risk factors, we need to control these factors. She will need to be on some medications from now onwards, probably some cholesterol tablets as well, and she will probably need a follow-up depending on how much her risk factors are every couple of years. And the way you follow up people is basically by simple stress testing, so putting them on a treadmill and make them walk and look for any tracing changes indicating that this lesion or this blockage is getting worse with time.
Okay. Dr. John, in terms of stent, as Dr. Tamer says, in terms of heart stent management, can it be required to be done more than once? Can it be repeated, for example? And what's the reasons for repeating?
Yes, so we know that if you have heart disease, or you have a heart event, like a heart attack, for example, your risk of getting another event is markedly increased. So having one stent does mean you can end up with more disease later on and have more stents in life. But just following on from what Dr. Tamer was saying, that absolutely, like, we only put stents in if we absolutely have to. So we generally look at when we do angiograms, we look at the arteries of the heart. If the arteries are severely blocked, and we define that by 70% or above, so 40% obviously being less, we would then choose to intervene with a stent, which is a stent is basically a metal tube that stays in the artery and opens it up and keeps it open. It stays in there for life. We choose to do that only if we think that that you would benefit from that. So either for what we call a prognostic reason, in other words, that we think it might make you live longer potentially, or if you've got a lot of symptoms like angina or chest pain, and we hopefully think that can perhaps improve your symptoms. But generally speaking, yes, one can lead to more, but we do our very best to control the lesions, or control the blockages with medications first. Do our very, very best. We leave the angiogram and procedures to the very last resort because they come with risks, of course.
أبونا Elijah, what's the effect of fasting on our cardiac health? يعني الصيام بقى يعني لما نيجي نصوم.
So fasting is very good for our health.
Yeah.
And what I love is that only in the last maybe 5 or 10 years has the scientific community caught up to the fact that fasting is useful. For centuries we've been saying intermittent fasting and صيام القطاعي. And now slowly there is some push to say that this is beneficial. For a long time we have a vegetarian or a vegan diet and people say, oh no, لازم نتغذى, we need milk, we need cheese, we need whatever. And now there's a strong push that this may be a better way of life. So the church, and we see that even in the Bible, with Daniel and his friends who refused to eat the delicacies of the king and ended up being stronger and fitter and more alert than the others who were eating the delicacies of the king. So fasting is good. Now in terms of studies, again the doctors may comment more, but what I have read is that intermittent fasting in the short term can help to promote weight loss, which is one of the major risk factors for heart disease. But compared to, that's initially, but longer term, it's no better than other things in terms of keeping the weight off, but it's good as a kickstart. And definitely one of the, again, talking about, say, cholesterol, one of the major risk factors for heart disease. If people are eating a diet that's really high in saturated fats, then that's not good for their cholesterol, which then can increase their risk of having a cardiac event later in life. So there's no question that intermittent fasting, so صيام القطاعي, and having a vegetarian or vegan diet can reduce my risk of heart disease. And that's of course eating a healthy vegetarian or vegan diet. Some people may just eat fried foods all the time, and but eating vegetables, salads, this sort of thing, it's good and much better than having hot chips and burgers.
In terms of eating healthy food, this has to do with heart health as well. Dr. Tamer, if you can talk about, tell us about the good and bad cholesterol, because this can affect the heart. Why we say this is good cholesterol and this is bad cholesterol? Cholesterol is a condition, so how can we say it one's good and one's bad? So can you explain for us?
So cholesterol is a very important risk factor for developing heart problems. And I think the problem with the cholesterol is that it's silent, so you don't know that you have a high cholesterol unless either you get tested or someone walks into the hospital with a heart attack, and that's the first time they know that they have a high cholesterol. And there are some genetic problems, so something like a familial hypercholesterolemia. This runs into families. So if the dad and mom or the dad have a familial hypercholesterolemia, that's high levels of cholesterol, all the family can inherit, or the kids can inherit this disease. So it's very important that we are aware of what our cholesterol levels are. When we take our cholesterol measurements, there's the two types, the HDL, which is called the good cholesterol, and then the LDL, which is called the bad cholesterol. And basically the good cholesterol, the HDL, is a good cholesterol because it takes cholesterol away from the blood into the liver, where it's metabolized. And cholesterol is important for that's how our hormones are formed, and vitamin D and so on. So cholesterol is useful in our body. But too much cholesterol in the blood will get deposited in the arteries. And so just to make it in perspective, these arteries that we're talking about, these are 2 or 3 millimeter arteries. So the biggest artery here is 5. So, when I and John are doing stents day in and day out, these are 2.5 millimeter arteries, 2.5 millimeter stents that we're putting in. So when you leave high cholesterol in the blood, it will get deposited in these arteries, and these will be the first arteries to block off. So people will start having either heart attacks or strokes as the first manifestation. So you really have to lower the cholesterol down. So the ones that we look for is LDL, which is the bad cholesterol, we have to bring it down, and the HDL, which is the good cholesterol, have to keep it up. What we eat, so as Abuna said, there's a few different types of cholesterol that we eat. So there's the monosaturated and the polyunsaturated fats, which are the good ones. And then there's the saturated fats and the trans fats, which are the bad ones. So in general, the polyunsaturated fats, things like the omega-3, which are found in the fish, the nuts, the olives, cooking with oil or anything else. These are all kind of the polyunsaturated fat, which is healthy. Staying away from the saturated fat, which is the ghee and the lard and the butter and all this stuff, which is the saturated and unhealthy fat. And eating obviously more vegetables and fish in diet. So increase your good cholesterol if you like, and that reflects in your blood test in the form of a good HDL, which is the good cholesterol, which takes your cholesterol away from your blood into the liver and lowers your bad cholesterol in the blood, which is the LDL, which get deposited in the blood vessels and form heart attacks later on.
And does the exercise have an impact as well on the cholesterol?
So exercise is very important. It regulates your cholesterol level, but it also regulates your blood pressure and does a lot of other things as well. So exercise is very important for maintaining heart health as well.
That's very good. I've got another question here, Dr. John. I have a few questions. Does human heart have a physical part of emotions such as happiness and sadness, love? That's a repeated question on the same question, but you can comment. And another one is, what is the heart in the Bible? This is for you, Abuna. So first question for you, John.
Look, Abuna answered that question very, very well. He answered that question. Look, yes, you can feel your heart racing, which is essentially the adrenaline drive in your chest, and perhaps that's why emotion has been linked to the heart for such a long period of time. On the converse, however, stress can also, as we talked about, stress can also be can negatively impact the heart in ways that are more than just emotion. So physically can do that. Often when people come in to hospital with heart attacks, you ask them, you talk to them, and more often than not, there are lots of cases where people have had an extreme amount of stress just before their heart attack. And while this is very difficult to prove that stress actually causes heart attacks, it is certainly associated because if you ask everybody's stressed, so that it's very hard to make an actual proof. But we do know that for whatever reason, if you experience a high degree of stress, that can actually destabilizing the cholesterol plaques that are sitting in your heart, causing a rupture of those. Perhaps it's the adrenaline, perhaps it's all these things affecting the layer inside the. Again, it's not proven as such, but it's an association. The one syndrome that we do know of, as I mentioned, is the what we call the Takotsubo syndrome, or the broken heart syndrome, which is it doesn't really affect the arteries as such, but affects the heart pump itself. That there must be some form of, again, the mechanism is a bit unclear, but people who've experienced a high amount of grief, such as the death of a loved one, it's more common in the middle-aged or elderly females in particular. They come to hospital feeling like they've got a heart attack, chest pain, and we have a look and we find that their heart is very, very weak. The pump is not pumping very well, and it mimics what a heart attack is, but it's not a heart attack. We only find that once we check the arteries and set there. Okay. And so, directly or indirectly, can actually impact adversely on the heart. It's a very fascinating phenomenon, I have to say. It's something that we see often and makes you wonder. People have chronic or long-term stress or anxiety, or people with, say, type A personalities, for example, who experience that high level of sort of stress constantly, do have an association with increased levels of cardiovascular disease during their life. So that's all very interesting in terms of the feeling of love, feeling in the heart. I guess all of these things are, like you say, Abuna, to do with the hormones, the adrenaline, etc., being experienced in that part of the body. But I'll let you finish that off.
Just to add it to what John said about the broken heart, we actually did a small study of the number of people presenting with the broken heart syndrome before and after during the bushfires. And we found that during the bushfires there was a surge in the number of people presenting with the Takotsubo, or the broken heart syndrome, because they were stressed about their houses and their loved ones. And so it's a very, when someone is under really stressed emotionally, then that's when they present with what looks like a heart attack.
Yeah. Abuna, as we're talking about the stress, it's one of the risk factors, and we need to know from the spiritual point of view, is there any spiritual ways to control or minimize or reduce the stress and anxiety in our lives?
Definitely, and it's really important. I guess one thing is not to forget that God designed our bodies in a way that when we exercise, it reduces stress. It's very well recognized that exercise releases, endorphins, which gives people a sense of well-being, a sense of happiness. So I think And God didn't do that by accident. So doesn't mean I'm not faithful, doesn't mean but you must exercise. But you can't exercise alone. There are other things that are really important. There's many studies looking at the role of food as well in my stress levels. And again, it's a bit difficult to know, are people feeling better when they eat better because of the food or because someone's taking an interest so much in what I'm eating? It's hard to know what's causing what. But there seems to be an association. People who eat better have less stress. From a spiritual perspective, stress is an invitation from God to pray, an invitation from God to feel His comfort. Don't decline the invitation. It's a chance. St. Paul says we glory in tribulations. We love these difficult periods in our life because it's a chance for me to run to the altar, to run to my Agbeya, to get on my knees in my room and experience God's blessing. So if I feel stressed, pray, run to the altar, but don't forget to exercise and to eat well.
Yeah, it's a good one, and you take it in a spiritual way. What would you say for people who, when they're suffering and feeling stress, they go to the worldly issues, a worldly solution to overcome the stress and anxiety?
Look, the worldly solutions are good, but the problem is the solution can never last forever. Yeah. I feel stressed, I watch a movie. Maybe I can forget for half an hour or an hour, but then as soon as the movie's over, everything comes back just as bad as it was and possibly even worse. So the world gives us short-term solutions which are not real solutions. God gives us long-term solutions, and He knows. He is our creator. You know, if my microphone stops working, who's the best person in the world that's going to tell me how to fix the microphone? It will be the person that made it, undoubtedly. So God Himself, my creator, is the one that said, you know, come to me and trust in God. Draw near to God and He will draw near to you. So He is your creator. He's the one that knows us best. And He's given us this advice in the scriptures. The book of Proverbs is full of this kind of advice. So who better should I listen to? Should I listen to Google? Should I listen to, with all my respect to the doctors, should I listen to them? I listen to my God. He's the one that's going to, He's the one that's going to tell me. He's my creator. So no one knows better what the solution is.
On the other hand, Abuna, peace is a virtue. And can peace help us or prevent some heart diseases? If we're talking about medical point of view, if someone is very peaceful and comfortable and rely on God and everything, is this can prevent him from having any diseases, or how can we gain the peace in our life?
So there are two things. So can being peaceful reduce the risk of heart disease, and how can we acquire peace? So I think both Dr. John and Dr. Tamer have commented on that. And Dr. John was just mentioning that there seems to be an association. It's very difficult to prove, because to prove that, what would you need? You'd need one group of people who are stressed and one group who are not stressed, and then we see what happens over 50 years. Find me someone who's not going to be stressed for the next. You can't do this study. So I don't think it's ever going to be proven. But there certainly seems to be an association. One of the doctors mentioned about destabilizing the plaque. So you have a cholesterol build-up in your arteries, 40%, 50%, 60%. But in a second, that 60% can rupture and become, in 1 second, it can become 100%. And perhaps people who are stressed or experience a significant event, there can be an increased risk of that happening. That the studies are not very clear. It's very hard to prove this sort of thing. There's no doctor in the world that's going to say stress is good for you. We all have to reduce our stress for our heart and for many other things. How can I have peace? Well, there's a beautiful hymn in the church which we sing, Prince of Peace. Prince of Peace is risen. Who should I go to for peace? Except the Prince of Peace. I have peace only in the Lord. I have peace in prayer. I have peace in the Psalms. Peace in the Bible. Peace in speaking to a spiritual father. Peace in reading a spiritual book, The Lives of the Saints. This is the true peace. The Lord says, my peace I give to you. Not as the world gives do I give to you. Not this worldly peace which is temporary. Not this worldly peace which is, that is not actually true peace. I have peace, but I'm worried about 1,000 things that I have to do tomorrow. When He gives me peace, then that peace is true. Not as the world gives does He give to us. So we come to Him in prayer, in the scriptures, in the sacraments, in the church.
دكتور تامر الحقيقة we talk about risk factors to avoid many heart diseases. لو اتكلمنا عن حاجات في حياتنا الحقيقية، يعني عايز الناس فعلا تركز على الحتة دي، يعني ايه اللي ممكن نعمله علشان نحاول ان احنا نتفادى اي امراض القلب وان اي حاجة ممكن في حياتنا العادية، يعني our healthy life نغير ايه ونخلي ايه من ناحية الاكل والمعاملات العادية في اليوم.
بص، هو في حاجات احنا مش هنقدر نغيرها، ففي there is risk factors which are unavoidable. فلو حد عنده family history of heart problems مثلا، that's unavoidable. You cannot change your family. You cannot change your gender. مثلا لو انت male عندك double the risk of having a heart attack. Our age, we all grow older. As we grow older, we will have a heart problem. So في risk factors are age والgender والfamily history. This is out of our control. في risk factors ثانية احنا we can control it. فمثلا لو احنا في حد عنده high blood pressure, he needs to follow that up and he needs to make sure that his blood pressure is under control. لو حد عنده diabetes مثلا, he needs to make sure that his blood sugars is under control. واللي احنا اتكلمنا عليه الكوليسترول والباد كوليسترول, فلو حد عنده high cholesterol he needs to make sure he takes the tablets والكوليسترول is under control. لو حد بيدخن عنده smoking, and I was having a chat with Abuna and John before this. Smoking is the biggest risk factor and it's the most avoidable risk factor. الناس you have to completely stop so you have zero risk factor from ناحية smoking. الحاجات الثانية مثلا زي drinking too much alcohol أو sedentary life أو lack of exercise in general. The recommendations of exercise is actually not that much. في لو قرينا guidelines about the heart foundations, the recommendations if you do 60 minutes of brisk walking at least 3 times a week, that's the basic that you can start off. If we can control our risk factors, as sedentary life, will weight as well, it's quite a common thing. You bring our BMI within the normal range. That's all one of the reduction of the risk factors that's required.
Yep. I will continue our talk on many different questions about the heart conditions after the break. Our viewer, I want to grab your attention that we're going to change the streaming of the lounge from Thursday to Tuesday. So we're going to change the day. الحقيقة حابين نقول لكم إن ميعاد إذاعة اللونج بعد كده إن شاء الله هتكون يوم الثلاث بدل من يوم الخميس, وهتكون الحلقة اللي جاية إن شاء الله يوم الثلاث 30/6. Next episode will be 30th of June and onward. Continue our question now, and we have a question with Dr. John about the heart failure. What is the heart failure and what's the causes?
So the heart failure describes the pump of the heart not meeting the demands of the heart. So the heart pumps blood to the body. If the heart is weak for a certain reason, then it cannot meet that demand. So you will experience that in terms of symptoms. You'll feel breathless, you'll feel fatigued, you feel like you are unable to meet the performance that you once were able to. So your heart essentially failing is not being able to pump an adequate rate, and the contraction is reduced. The reasons for that could be plentiful, but essentially we know that there could be problems with the arteries of the heart, so what we call an ischemic heart failure or heart failure due to blockage in the arteries. That's the most common worldwide. There are other causes of heart failure, for example, the muscle itself being weak for other reasons. For example, the tissue itself is not healthy for lots of reasons, one of them being genetic, for example. The valves could be quite leaky, and so when the valves are leaky, you can imagine that the flow of blood, instead of going in one direction, it goes in one direction and comes back, and so that puts a lot of volume pressure on the heart, and so it can fail because of that. And finally, the electrical supply of the heart could also be impaired, and so instead of beating in a rhythmic fashion, 60 beats, 70 beats per minute, it could be beating at much higher rates, for example 130, 140 beats, like as if you're exercising but you're not doing anything, you're just sitting down. So these electrical failures can also cause the pump to become weak, and there are plenty of other causes, but essentially if the general idea is that if you do experience heart failure, they're mainly experienced by symptoms of breathlessness and swelling. If you do have any of those, you should seek medical attention, and we can have a look and see what the cause of the heart failure is.
Okay. شكرا دكتور جون. الحقيقة مشاهدينا نحب نكمل كلامنا بعد الفاصل ونعرف كمان حاجات كتيرة عن الأعراض اللي ممكن إن هي ممكن تجيلنا من أمراض القلب المختلفة وإيه أنواع العلاجات الجديدة هنشوفها بعد الفاصل.
The king knelt down. The king, he fell in fear. And with all of him he bowed as all of us we peer. And in his tears we heard him scream, "Oh God of gods, oh King of kings, incline your ear, O Lord, and hear the cry of my people whose end is near." The king knelt down. The king, he fell in fear. And with all of him he bowed as all of us we peer. And in his tears we heard him scream, "Oh God of gods, oh King of kings, incline your ear, O Lord, and hear the cry of my people whose end is near." And I, their king, can save them not, for I am only man if they forgot. But I remember this and also their God, so incline your ear, O Lord, and hear the enemy waves its victory. Oh, hear them laughing and them mocking me. Surrounded I am as he stands tall in tears. I am the collection of all your failures and fears. Your hope is vain, the rest all failed. Why even try to surrender his name? Oh God of gods, oh King of kings, oh can't you hear them as they scream? So incline your ear, oh Lord, and hear. Open your eyes, my God, and see. Watch as your children troubled and toil, crying to the Father who told them all, just call. One day and I will find you in the midst of all this mire. So open up your eyes and see how we bow here on our face and knees. Save us, oh God, I plead, do not give up on us in our need. Let us not fall on our faces in front of the world, waiting for us to fail, but instead come, lift up our heads, fill us and be all that remains. Oh God of gods, oh King of kings, incline your ear, O Lord, and hear. Open your eyes to us below and see. Oh God of gods, oh King of kings, incline your ear, O Lord, and hear. Open your eyes to us below and see. Oh God of gods, oh King of kings, incline your ear, O Lord, and hear. Open your eyes to us and see.
Welcome back, Dr. Tamer. I wanted to ask one question. If I'm concerned about my cardiac health, based on everything that we've heard so far, I guess the first step would be to go and see my GP. But what should I expect from that visit? Is it just some blood test and that's it, or is there something more that we should do if I have no symptoms?
I think if someone has no symptoms and he or she is worried about the risk factors, So first of all, there are quite a few risk calculations or risk scores that are actually online. So if you type in Google just the cardiac risk scores, there are quite a few risk scores that come up. And the idea of the risk scores is to try and tell you the predictions in the next 5 years, likelihood of you having a heart attack or someone having a heart attack is more than 20%. And if you come up as a high risk score, then you're advised to see a cardiologist for further assessment. And sometimes the risk score is kind of in the middle, so it's not really high, it's not really low. And so there are new advances in medicine now, so things like CT calcium scores, which can help classify you either having a low score or a high score. And the good thing about the CT calcium score is that it's a simple test with a very low radiations, and it can be ordered by the GPs because it's on Medicare. If you have zero calcium in the arteries, the risk of having a heart attack in the next 10 years is actually very low. If you have a very high calcium score, above 400, and that means that you're above the 90th percentile, the risk of having a heart attack in the next coming 5 years is very high. And so you need a stress test to further assess that. So just by doing a calcium score plus, seeing the risk factors. So if someone has a long-standing diabetes for 20 years, I always recommend that these patients definitely get a stress test. Diabetes affects all the arteries in the heart, and it's the highest risk factor for having coronary artery disease long term. So it depends on the risk factors and things like calcium scoring, and it depends if you have family history as well. If someone does have a strong family history, and I mean strong family history, people in the family having heart attacks at the age of 55 or 60, that's a very strong risk factors as well. So you probably need to have some form of stress testing and more clarification of your risk factors.
Okay, thank you.
Just to follow on from that as well, it's very clear to make distinction between assessing cardiovascular risk and screening for cardiovascular disease. They're two very different things. So if I am concerned and I am what we call asymptomatic, I have no problem, but I'm concerned and I seek medical attention and I ask you, what's my risk? That's the concept of looking at your risk factors, your diabetes, blood pressure, cholesterol, smoking, etc., family history, using that calculator, as Dr. Tamer said, working out what your 10-year risk of having an event is. In other words, the risk of having a heart attack is. And if you're high risk, then I can give you medications, for example, cholesterol medications, for primary prevention, in other words, to prevent the initial event from occurring. Okay, that's without doing any testing whatsoever. That's basically what I mean by testing is specific heart tests. We're just doing basically, essentially, looking at cholesterol, blood pressure, things that are simple that can be done in any office. But if I am very concerned and I want to take it further and I want to be screened for heart disease, as Dr. Tamer was saying, then that's when you are referred to a heart specialist. They can then do a stress test, work out whether you've got heart blockages, or do a CT scan, look to see if there are heart blockages, and tell you whether you are likely to have or unlikely to have heart disease in that instance. Unfortunately, the evidence behind screening, so everyone should have cardiovascular risk assessments, look at the risk factors and modify them, healthy diet, exercise, etc., medications, things that we should all engage in with our GPs regularly, perhaps even annually. That should be done as a recommendation for everybody. But screening is, unfortunately, it has much less evidence behind it, because we just don't know whether if we send everybody to a treadmill test and see if they've got heart disease, whether that actually reduces outcomes long term. It's very hard to prove. Unlike in cancers, for example, we have screening tests available like colon cancer screening, breast cancer screening, cervical cancer screening. These are well established. We know that the risk of screening is less than, the benefit of screening far outweighs the risk, because of course the risk with testing is that you find something which is what we call a false positive. Every test means that if you are flagged with a problem that's not actually true, you end up with more tests, and these tests can come with risk. And so we don't actually have good evidence to say that screening the population for heart disease reduces outcomes in terms of heart attacks long term. We don't have that data. But if you're concerned enough, or you've got high cardiovascular risk, or if you're a diabetic, then yes, certainly we can screen you for that, and that's what you would be referred to the heart specialist for.
Thank you. And I just have a follow-up question about smoking. So you mentioned smoking as a risk factor frequently, and that's smoking cigarettes. Many people engage in other kinds of smoking, like shisha or nargile, and there's a perception that the risk of these is lower than cigarettes for heart disease. Could you comment about that?
Depends what flavour. That's your answer.
So it's easy to quantify how much people have smoked when they smoke cigarettes. So he can come to the clinic and say, I've smoked 10 cigarettes a day for the last 15, 20 years. So it's quantitative and we can measure that. And the risk obviously increases as the more you smoke, the longer period you smoke. But unfortunately with other kind of recreational things like the nargile and the shisha, it's very hard to quantify how many or how much grams of nicotine are in every single time. And so there's speculations that, you know, when you smoke one nargile, it's like 100 cigarettes, which is, you know, I don't know how, that's like 3 packets of cigarettes in one day. How much of inhalations do you take with every deep breath as well? So, you know, all this is very hard to quantify, but in general, just to put it blanket, that it's the most modifiable risk factor. So you're putting yourself, when you smoke nargile, when you smoke cigarettes, when you smoke all these things, you're just putting yourself at a higher risk of having heart problems for no obvious reasons. So, you know, when someone comes to the clinic, I actually spend 15 minutes of my time talking about, you know, just lifestyle modifications, and then another 10 minutes talking about the medications, because it's very important that they change their lifestyle. They stop smoking after the heart attack. They take the tablets. They start exercising. They try and reduce your weight, and they try and, you know, these are the modifiable risk factors that, to me, as a person following them up, it's more important than him just taking the tablets.
It really shows you the power of addiction, and sometimes the people who actually do have heart attacks, we think maybe they'll stop smoking, but in actual fact, you know, a good number come back with another heart attack because they continue to smoke. And I always wonder what, you know, that obviously that it's a very hard thing to break an addiction. We have lots of therapies for that, but I wonder, Abuna, if you have any sort of advice for this, because sometimes you know, the medications we give are ineffective because there's a lot of, you know, there's a huge psychological component. There's a huge void, perhaps, that people are trying to fill. And I just wonder, in the face of self-harm, how we can continue to smoke or drink or do these things, or other, you know, in the same way that other addictions are sort of maintained. But this one being the most powerful, modifiable, as you said, risk factor. Why do people continue to do such things, self-harm, in the face of all the evidence?
I think that's the hallmark of addiction. One of the is that it's continuing to do damaging behaviour in the light of obvious negative circumstances. We see that with smoking and alcohol, drugs, gambling. You know, people keep losing and losing and losing, and they continue. So this is just a hallmark of addiction. I think you touched on it, John, in your question of people are trying maybe to fill a void to some extent. So one famous author, C.S. Lewis, said, you know, he's speaking philosophically, that in every human heart there is a hole the size and shape of God. And if we try to put something else in there, it's never going to be satisfied. But there is a God-shaped hole in every human heart, and we have to really find God. That's not to discount the role of medicine in overcoming addiction. It's really, really important, and these days there are so many good treatments for people who are trying to stop smoking, whether it's nicotine replacement or a tablet called Champix, and there are others out there. They're really effective. So it's a combination of things that I have to talk to my GP, get some advice, get some medication if I've tried a few times and haven't been successful on my own, but maybe speak with my confession father as well and say, look, let's have some spiritual things as well to help me overcome this addiction, and to dig a bit deeper and see, is there some need that I have, is there some hole in my spirituality which I'm trying to fill with short-term pleasures of this world, but I really actually need to fill them with God. So we need a spiritual approach and a medical approach together.
Sometimes, Abuna, I've got maybe some people think about if I have any of one of the heart diseases and has to do with preventable causes or lifestyle choices like smoking, for example, or unhealthy eating. If I prayed and asked God, please heal me, does God can help me or heal me, or refuse?
We thank
If
God.
it's my choice to do the wrong thing.
We thank God, and I may try to speak in Arabic for the sake of our Arabic viewers. يعني نشكر ربنا إن هو حنين أكتر مننا. عشان لو أنا بقول لواحد ما تعملش كده، ما تعملش كده، ما تعملش كده، لو عملت كده ده اللي هيحصل، لو عملت كده هيجي لك هارت اتاك، وفي الآخر يجي له هارت اتاك. أنا دمي محروق، ما أنا قلت لك خلاص بقى أنت دلوقتي مسؤول. أنا قلت لك ماليش دعوة. بس ربنا حنين أكتر مننا. يقول لنا ويقول لنا ويقول لنا. وإحنا ما نسمعش الكلام. And we see that in the whole Bible, in the book of Judges, for example, يعني time and time again, the people were refusing what God was saying, and He would warn them and remind them. But He was merciful. He's our Father, and هو أب بيحبنا قوي وحنين قوي وعنده صبر. So don't ever think in the خلاص أنا اللي عملت كده في نفسي ربنا. يعني He's your Father and He loves you. And we just read in the Gospel last Sunday, if you as men are able to give good gifts to your children, how much more so can your Father in heaven give good gifts to those who ask Him? So if I feel like I'm responsible for this وربنا ملوش دعوة, this is a trick from the devil.
Yes.
He's your Father, He loves you, ask Him.
Dr. John, you talked about before about the early detection of heart disease, and I've got one of the questions related to this. One of says I'm in my 20s and I have a high resting pulse of 90. Do you think that this could be a heart problem? I'm exercising regularly and skiing. I don't think I smoke.
There's generally a healthy
I don't
range.
drink or smoke, sorry.
There's a healthy range. There's a normal range
Yep.
of heart rates, of blood pressures. Generally speaking, we say a heart rate of 60 to 100 is normal, but really probably between 60 to 90 is normal. Again, if you look at the heart rates, they usually vary during the day. So 90 during the day, 80 during the day, and perhaps may drop while you're sleeping. And there's this what we call diurnal variation of blood pressure and heart rates, and we usually recover at night, and during the day when we need a bit of extra heart rate, it goes up. Generally speaking, a heart rate of 90 does not mean you have heart disease. You need more evidence than that. And if she's concerned, of course, she needs to be examined and assessed by her doctor. But generally speaking, you can't use one number and say that is equivalent to. And
What
there are
would
lots
you
of
advise
ways.
her?
So if you're concerned, see your GP
Yep.
first up, and we can and be assessed. But generally speaking, if you have a heart rate of 90 and you're otherwise well, no symptoms, you have no palpitations, no lightheadedness, no. By palpitations, I mean the feeling that your heart is racing or jumping out of your chest. It's not affecting your you don't feel lightheaded, you don't feel dizzy. You have no physical symptoms when you exert yourself. So in other words, when you walk or do activity, you don't feel like you have any pain in the chest or breathlessness or excessive sweatiness. Then generally speaking, it's fine. We really just have to make sure there's nothing underlying this, and we can always prove that you're okay with other methods by monitoring you at home, etc. But there's got to be a little bit more evidence than just a heart rate of 90 to take it further.
Dr. Tamer, if we would like to talk in brief, what's most common treatment or management for any heart diseases at the moment? Any new research is coming up? Any new treatment?
So it depends on the nature of the disease. We classified the heart disease into 4 categories. So if it's rhythm problems, there's devices like pacemakers and defibrillators. They're very clever devices that get implanted under the skin, and that treats most of the rhythm problems. There's also tablets. If it is valve problems, in these days, especially in the last couple of years, there is a keyhole procedure that implants valves, so it's become less invasive than an open heart surgery. And there's different ways to treat different kind of valves as well. If it's narrowing in the arteries, so procedures which is called angiography or angioplasty, where we put stents inside the heart by fixing all these blockages. And if it's just a heart failure or weakening of the muscle, then there is also a specific kind of medication, a combination of medications that people need to stay on to help the muscles. And cardiology, one of the good things, or why it's attractive, is that every few years there's a big leap and advance in cardiology and advancement. So things that we did not exist 10 years ago, now there's a huge kind of an array of equipment and devices that exist and medications that never existed 10 years ago. So there's always innovations and new technologies coming up, especially in the scope of cardiology.
Bunaim, last question for us. Blessed are the pure in heart, for they shall see God. What does it mean to be pure in heart?
Purity in heart, when something is pure, it's not mixed with anything which is contaminating it. If you have pure water or pure gold, it's just something that is perfect. I was recently reading a book called The Imitation of Christ, just by chance actually, and this verse came up, blessed are the pure in heart, for they shall see God. But the author was using a different translation and translated purity in heart to single heart, single-heartedness, which means I have one desire, one focus, one goal, which is to be with God here on this earth and ultimately with Him for eternity. And I guess when you think about that definition, maybe the verse makes a bit more sense. Blessed are those who are single-hearted, those who are focused on God, because they will see Him. So pure in heart means focused on God.
Okay. Thank you, Buna. We came to the end of the episode. Thank you very much.
Thank you,
Dr. Tamer. Thank you, Dr. John, for all the information that you have given. Thank you so much. Thank you, dear viewer, about this, following this episode, and we wish all of you the blessed and healthy heart. صحة القلب دي حقيقة نعمة. وربنا لما حب يوصف قلب داود قال فتشت قلب داود فوجدته حسب قلبي. احنا نتمنى لكم كلكم ان انتوا يكون قلبكم زي قلب داود، وكل واحد فينا يحط اسمه مكان داود ويتمتع بعمق محبة قلب ربنا. الحقيقة we see you next episode. We're going to remind you one more time that next episode is going to be on Tuesday, 30th of June. And we have a very, very interesting topic next time. We have a topic about the black magic. Does the black magic exist? Does anyone still believe in black magic? الحلقة الجاية إن شاء الله هنتكلم فيها عن السحر وعن الشعوذة. أتمنى تتابعونا، واللي عندنا مفاجآت كتيرة ليكم، معلومات كتيرة قوي هنعرفها لأول مرة الحلقة اللي جاية. أتمنى تكونوا معانا. طبعا هنتكلم فيها بمفهوم وبرؤية مسيحية جدا. أشكركم، نشوفكم الحلقة الجاية.